Hi, my name is Dr. Kristen Gooding. I'm the Director of Critical Care here at DLEAH, and I'm here to talk to you about how to set up our high-flow nasal oxygen supplementation unit called the Vapotherm right here. So things that you want to get set up prior to bringing out the Vapotherm can all be found in our ICU closet. When you remove it from the bag, these are the separate units. We have our water path and the cartridge together already mounted, and then we have the circuit that plugs into that cartridge. We also have a sterile bag of sterile water, which is what we need to humidify this warmed air. And then we also have just some supplies to be able to help anchor the nasal cannulas onto the patient right along the face and the nostrils. So there are 7 different nasal cannula sizes offered. Once out of the packaging though, the best way to know the cannula size being used on that patient is by the plastic colored band located on the tubing itself. The table provided here actually divides out the available nasal prong cannula sizes with their corresponding color identifiers, their flow rates that are possible using that tubing size, and the outer diameter of the nasal prongs. The golden rule in nasal prong selection is that the prong should never take up more than 50% or half of the patient's nostril opening. This allows for excess airflow to exit the patient's upper airway without accumulating further down into the lungs, which can then lead to barotrauma and patient discomfort. The right-hand column takes the outer prong diameter listed and then just simply doubles it. It's a way to help quickly confirm the minimum nostril diameter needed for that particular cannula size. So just a little bit of math done for us. You can also see from the 4 smallest cannulas that some are so narrow that they can only provide lower flow rates, and that some of the larger cannulas only go down to a minimum flow rate. So the veterinarian's prescription of the flow rate can sometimes alter that cannula size after you measure the minimum nostril diameter, just depending on what type of flow that patient is going to need. And then lastly, there are some that have identical flow rates and prong diameters. And really the only difference between those two is a little bit of length of tubing between those nasal cannulas and then connecting it to the actual circuit tubing. So the ones that are identical, like the light blue to the royal blue, the only real difference is a little bit of extra length between those two. So as we continue to use the Vapotherm, we probably won't continue to purchase all 7 sizes. We're going to figure out which ones work best for our hospital and where those patients are located and go from there. So now that we talked about all of the things that you want set up, we're going to talk about how to actually set up the Vapotherm unit. So coming on over to this machine is purchased with an air compressor. The reason why we have an air compressor is that we don't have medical grade air within the circuit of the hospital, but you can purchase an actual portable air compressor, making sure that we have medical quality air running through this machine. This is the actual Vapotherm itself. And then we have it mobile on this IV pole, which is really convenient when you have to put it next to a run, in a run, move a patient around, all of those things. So it ends up being quite a compact and convenient way to use this modality of oxygen supplementation. Okay, so what we want to start with is we want to actually start by setting up the cartridge into the Vapotherm, and then we end up plugging everything in. So when you want to take out these 2 pieces from the high flow circuit package, you want to be wearing clean gloves. They don't have to be sterile necessarily, but they do have to be clean, so don't want to use your bare hands. Now I'm going to take the cartridge and the water path out. It comes together. This is the cartridge that's already adhered to the water pass. And then this is going to be the water pass, what actually heats up the water as it goes through. Okay, and then this is actually going to attach easily to this water pass. So I'm going to put this down right here. I'm going to pull this out. And you can see there's 2 ends. One end has this kind of white adapter piece on it. This end has the blue adapter piece on it. The white adapter piece is what's going to connect to this kind of white portion of the cartridge. So if you want to look very closely, you will see that this cartridge has an opening here that has 2 kind of circle inserts, and this actually has two prongs that fit right into it. So all you need to do is just put these two together and firmly press in. And that's how you attach the circuit to that cartridge. Now I'm going to take this entire apparatus and install it into the Vapotherm. So before installing it, you do want to see that this metal strip here needs to be in contact with this machine's metal strip there. Once you have that guideline, everything is pretty self-explanatory from there. So metal strip, metal, goes right on in here. And all you need to do is firmly press it down. And this machine, this cartridge does not click actually into the machine. You just have to kind of push it down, and that's all you need to do for that. The next thing I want to grab is sterile water. So sterile water is not saline. It doesn't have any electrolytes in it. It's just a water-based solution. And again, it is sterile because we will be running it through a machine and giving it to our patient through the respiratory tract. So once I remove that plug, I also then remove this plug. And all I need to do is insert this spike into the bag. And making sure that this is clipped off, I'm able to flip this back right side up and hang it right here. You never want to have this sterile bag empty. So as this sterile water continues to be utilized for this patient, you will always need a secondary sterile water bag nearby. You can either have it hanging here on your pole, or we actually put it here in our little basket in front. But you do always want one nearby because you do not want this to dry out while it's running. I want to open up the door again and show you that right here on this cartridge is where you actually put the date that you initialed it. So you want to put the date, and that's because for non-infectious patients, we can reuse this entire circuit. We would only replace the sterile water bag and the patient cannulas for a new patient. If they are infectious, the whole cartridge has to go. But if they are not, then you want to always look at that date and make sure that you don't have to remove that cartridge and start all the way over with brand new equipment if it's within that 30-day mark. I am going to fill now the sterile water into that cartridge by unplugging that clamp. And you are going to see water start to trickle downwards because it takes about 200 milliliters to fill up the cartridge. This is continually filling up the cartridge, and also if you notice that it's starting to fill the actual circuit. This circuit is like a multi-lumen circuit. You got the inner circuit that actually has the oxygen and the medical air mixing, and then around it is actually where all of this sterile water that's warmed by this machine ends up going through this entire circuit. The next thing that you want to do is actually turn on the machine and set the parameters that were prescribed by the doctor. So before you turn on the machine or run the machine, you want to actually turn on the air compressor. You need to make sure that the air compressor is running for a few minutes. Usually I say about 3 to 5 minutes, and that's to make sure that we don't have any humidified condensation accumulating within the machine. You really want to have that dry air circulating before. So to be able to turn on a portable air compressor, there is a switch, a hard switch in the back of the machine right here. All I have to do is switch that on after I plug it into the wall. So this gray cord plugs into the wall, and then I flip that right on. And you can hear the air compressor working at this point. It's not too loud, but definitely should make a little bit of a rumble. The next thing you want to plug in is going to be the actual Vapotherm machine. That's this black plug. I'm going to plug this in as well. With this green tube, this is going to be your oxygen connection, and we have oxygen right here. And you can put it in any of those green wall connectors we have at the hospital. And again, you can see here that our bulb here is starting to twist. We really want to make sure that this stays perpendicular like that. And the way that you do that is you actually have to manipulate this tubing to make sure that, say like we move the machine, we just want to make sure that this back area remains vertical. So now we have the machine on, we have the cartridge filled, kind of pre-filled, we have the air compressor on now for several minutes before then we would ever start using the machine. So you can turn it on by plugging it in, and this is what it looks like kind of, I would say, in standby mode before anything happens with the machine. So let's talk a little bit about these buttons. This right hand button is to turn on the machine to kind of say like I want it to go. As you can see when you plug it in, this is what it starts with, but to actually press this button would start the flow. As you can see, if it's solid amber, there is no flow happening. This is going to be your alarm button. It's going to alarm, and on this left-hand side, there's going to be some type of symbol that you can reference with the user manual to make sure that you understand the types of alarms, so you're not just silencing it by pressing that button, but you're actually taking care of it. Then there's a center dial. This is going to be our universal dial for all of these different color numerical units that we want to set. And turning it to the right is going to turn it up, any of these numbers. Turning it to the left turns it down, and then pushing it in the center is going to lock that number in place. Okay, let's now talk about the actual numbers that are on this machine. Looking at it, we have three kind of different colors. We have this white color in liters per minute. This is our prescribed flow for our patients. Usually we are prescribing 0.5 to 2 liters per kilogram per minute. And so with that in mind, we want to make sure that we ask the veterinarian what the prescription is for that. They will let you know. The second thing is the oxygen percentage, or FiO2 percentage. This is how much oxygen percentage-wise mixed with air is being delivered to your patient. Room air, like we're breathing right now, is going to be 21%. When we want more oxygen to go to this patient, we are going to turn up that dial for higher parameters than that. When we start patients on a Vapotherm, we're typically starting them at 100% oxygen. The last color, red, this is actually the temperature. So we're setting the humidified air to a certain temperature that's the same as their body temperature. And it's usually going to be anywhere between like 35 and 39 degrees, but I usually kind of set it at 37 degrees Celsius. Lastly, there's a symbol over here. It shows actually the type of cartridge that's inside this machine. So this says high for a high flow machine, or cartridge, sorry. If we have a low flow cartridge, because we have a really small patient and we can only go up to, let's say, 8 liters per minute, then you would put in a low flow cartridge and an indicator would be right here. Instead, it would say low. So it just tells you what type of cartridge you have in the machine. So let's start actually manipulating these dials for a prescription, because I do have a patient named Nellie that's suffering from hypoxemia, and we're going to show you how to suture the cannulas in to that patient, and so I have a prescription for that pet. Okay, so I start by just turning the dial and then pushing just to see where it starts. It usually starts with the oxygen. It's at 21% because we're only at room air. No oxygen is actively going through the green tube at this point. So I'm going to turn this up to 100% because that's how I want to start most of my patients. Turning it clockwise to 100. I am now ready for that script to be in there, so I just press the center dial and it jumps to the next one. I'm going to change this to 37 degrees Celsius, like that. And then I'm going to start this patient at 20 liters per minute. It's a very large breed dog. He's about 40 kilograms. And so with that, we want to make sure to give him 20 liters per minute. Okay, so we have everything prescribed in here. The only thing that we have to do is we need to change this from no flow to flow. And so I'm going to press this right hand button here, which is the same as that on button. First thing it's going to do is actively coat, like we were talking about before, the entire circuit. And it's actively doing this because it needs to warm that water first. So the sterile water comes in at room temperature, gets heated by the machine, and so it is going to take us several minutes to actually get this Vapotherm up to 37 degrees. So while the machine is setting up, you are going to see a green flashing indicator. It means that it's flowing, but it's not ready to be hooked up to the patient. It's not until this reaches the designated temperature that this will turn green and we can touch it one more time, and that's when we can actually initiate the treatment. All right, so now we're up to the temperature of 37 degrees Celsius. Now you can see that the green flashing light is now a solid green. This machine is now ready to use. It took us about 5 minutes to get the machine warmed up, the temperature warmed up for you to then be able to place it on the patient. So then before you attach it to the patient, what you want to do is you want to take your sterile cannula. So you want to grab the cannulas that are the appropriate size for your patient, making sure, again, 50% or less of the diameter of the nostrils should be the diameter of your cannula. Here is a demo one. So all you would need to do is just plug this up like so, and then we'd be able to place this on the patient. Another thing that you can do is place this on the patient, and then once it's already sutured in place, then you can attach it. That's the way I prefer to do it. When you have a portable air compressor, that compressor is going to dry out that humidified air and collect some of the extra residual condensation into this bottle right here. So I usually recommend checking that bottle at least every 12 hours to make sure that it does not need to be emptied. To empty it, you just pull it out of the styrofoam cushion, pull it out that way as well. That straw stays in place. You dump out the water until empty, and you put it right back into place. So this is the water level. Pretty much it's just telling you that you don't want to fill it past the top, but you can empty it really at any point that you'd like. When you're done using the unit, I also like to toss that extra water. All right, when the patient is done using this machine, let's say they're discharged from the hospital or they are weaned off the Vapotherm, as long as it's not an infectious patient, you can go ahead and keep several of the pieces in the machine waiting for the next time it can be used. The parts that can be reused includes this circuit, the cartridge and water pass within the unit, and all you need to do is cap this end and also tighten and clamp off the sterile water. Okay, so I'm going to turn off the machine and show you how I'm going to do that. So in between uses for non-infectious patients, what we can do to occlude the end here and keep it from becoming contaminated is opening up a set of sterile gloves, putting them on yourself like so, taking the end here, pulling it back, taping this in place. This is now as clean as we can get it. Then again, you want to clamp this off between uses, like this, totally occluded. Keep the water bag connected to the cartridge. Keep everything connected to that cartridge. So this is how it's going to look in between. And then we can go ahead and unplug and turn off the air compressor. So I'm going to unplug the Vapotherm, turn off the air compressor, and unplug the air compressor.